Hello everyone. Today I am going to discuss about disease of the dental pulp. The pulp is the formative organ of the tooth. It builds primary dentin during the development of the tooth, secondary dentin after tooth eruption, and reparative dentin in response to stimulation as long as the odontoblasts remain intact. The pulp has been described as a highly resistant organ and as an organ with little resistance or healing ability. Resistance of pulp to injury in slight in certain cases. Accurate pulpal diagnosis is clinical symptoms and histopathology of the pulp. To diagnose the condition of pulp based on either clinical sign, symptom, electric pulse test, thermal test, and radiography have not always been successful. The endodontist is expected to understand the various causative factors of pulpal disease, collect information about the presentation and history of symptoms, and conduct many practical tests before formulating the final diagnosis. Now we start causes of pulp disease. The causes of pulp disease are physical, chemical, and bacterial. They may be grouped as: first is physical causes. Physical causes included mechanical or thermal injuries. Mechanical injuries. Mechanical injuries usually due to either trauma, pathologic wear of tooth. First, trauma. Traumatic injury may or may not be accompanied by fracture of the crown or root. Trauma is less frequently the cause of pulp injury in adults than in children. Traumatic injury of the pulp, some reasons are uh, automobile accident, household accident, such habits as opening bobby pins with the teeth and nail biting. They may also cause pulpal injury. And second, heterogenic dental procedure during cavity or crown preparation. So accidental exposure of the pulp during excavation of carious tooth structure, rapid separation of tooth by means of mechanical separator, the use of pins for mechanical retention of amalgam or other restoration. Second, pathologic wear, adhesion, abrasion, bruxism, effraction. The pulp may also become exposed or nearly exposed by pathologic wear